Instagram and Facebook. Don't see us yet. Are we streaming?
Yep.
I guess we are, huh? Mm-hmm. It says up there, but it's not showing me on here. There it is. All right. People joining in. Let's see. TikTok's about to go live. Instagram and Facebook are live. All right. Great Tuesday so far. Thank you guys for everybody that's joined me so far. Waiting for everybody to come in here. And then we'll get this bad boy kicked off, Titan Talk Tuesday, like we should. And I'm going to talk about our special of the week, which is Tesamorelin. There's another Libido package that's out there that you guys could take advantage of. And we're going to talk about also, some of the different things that you guys can do to help you guys get fit. And then I'm answering any questions you guys have. What's going on? Dan, how you doing, bro? Hope all is well. And I think we're live here. All right, awesome. TikTok too as well. All right, cool. So want to get this thing started. Thank you guys for joining me. Titan Talk Tuesdays every Tuesday with me, John, CEO and founder of Titan Medical Center. And I'm here to answer all your questions, whether it be about any of our therapies or services. And if you don't know what we do, just let you know real quick. Hormone replacement therapy, both males and females, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, libido enhancers, peptide therapies, blood work, and everything that's going to make you look good, feel good, and perform better. We're here for you guys. So at that point, we can help you guys out in all these different ways nationwide. So wherever you guys are at, we can help you out with service. So don't worry about us just being in Florida. We can service you wherever you're at in the United States. All right, so 37 trinkets. Who should my daughter contact to volunteer in the office? They can contact the number. They can actually text the line, 727-389-3220, our main line, and say, John said to have me contact you about my daughter possibly volunteering in the office. And then we can look at that and see how that works. How old your daughter is, is it her background? We want to know some more information, but that would be awesome. We would definitely love the help. We have so many different things that we offer and that we do. So not even just in the medical side, like our promotion and event side, it's a huge different thing. And it's just going to get bigger and bigger as we keep growing. So, and I've got a lot of things up my sleeve for you guys, coming in the next year and next too. All right. We were a vendor Saturday. We have Liz our contact. Okay, cool. Yeah. Oh, you gave Liz your contact. All right. I'll ask Liz about it when she comes in. Hi from Hawaii. Kappa John, what's going on? Big shout out from Hawaii. Wherever you guys are at, man. This is awesome. Thank you guys for joining me. And like I said, I want to get into it. So peptide therapy. And if you guys have any questions about anything I'm talking about or have your own thing, please shout out to me. So let's talk about Tesamorelin. So Tesamorelin is the therapy of the week here at Titan Medical Center. And Tesamorelin is definitely getting to be one of my favorite therapies for patients to utilize. And the reason why. So a lot of patients, especially as we age and everything like that, growth hormone levels start decreasing and start, going down. And then a lot of people out there, they get told like growth hormone is the way to go to lose weight, to stay young and to anti-age. Well, the fact about it is that growth hormone is really expensive. Real growth hormone. I'm not talking about your buddy getting it or you getting it from China or someone. I'm talking about from a U.S. licensed pharmacy, even commercial product, because they don't make a compounded growth hormone product, human growth hormone product. So at that point, it has to be commercial. So it's really, really expensive. To do what you want to do, to feel young, to anti-age, it's going to be anywhere between $12 to $15 to $2,000 a month, right? And more, depending on the brand that you get. Because some brands are more inexpensive than others. I know this. I'm telling you guys. So you guys can look this up on GoodRx too as well and look at the pricing. So that's one obstacle. The second obstacle is getting a doctor prescribed growth hormone. It's rare. A lot of doctors won't prescribe it because they get looked at by the DEA, and the DEA looks at usually controlled substances. And growth hormone is not a controlled substance, but it gets looked at like that. And there's doctors that have lost their licenses for this and all the different things for prescribing. So doctors usually stay away from it. That's like a no-no. We'll do everything else except for that. That's not a good one. So at that point, what can you take that's going to help growth hormone, right? And growth hormone is great, right? As far as that goes, I think in little doses, especially when you need it and you start declining on your IGF-1 levels, which are growth hormone levels, then at that point, we need to look at some sort of substitution for that, or something that's going to help optimize that. Because when we talk about IGF-1 levels going low, we talk about aging prematurely, not feeling your best, unenergized, muscles, like everything. So at that point, we want to make sure that level is good. Now, if growth hormone is not an option, right, what is the best option after that? And listen, there's plenty of GHRH peptides that are still on the market. We still got CJC 1295 with ipamorelin. You got MK677, which is your oral pill. And then you have Tesamorelin. So Tesamorelin is great because, one, it's a GHRH. So it's going to stimulate your natural growth hormone levels. This is going to be great because this is what we want to replace, optimize to make you feel better, look better, anti-aging, perform better, the whole nine. But the second biggest thing, and this sets Tesamorelin apart from any drug on the market that I've seen. There might be a couple other ones for HIV patients, but in GHRH land, let's put it that way, or preventive anti-aging, Tesamorelin targets adipose tissue. This means belly fat. This means the bad fat that surrounds your organs that is unhealthy for you. Now, all fat in your body is not good for you, but you got to have a little fat, right? But when you have adipose tissue and you have a lot of belly fat, you accumulate that can cause other health issues down the road, and you don't want that. So with Tesamorelin, you're knocking out two birds with one stone. One, you're targeting belly fat, which I don't have anything else here that does that. That's the only one that targets belly fat. Because usually when you lose weight, you lose it all around, from the face to the neck to the arms to the legs and such. But with this targeting that is a game changer across the board. So Tesamorelin. And Tesamorelin, if you guys get it this week, there is a discount on it. To say you heard it from me on the live, and you guys will get that discount, or say I want the Tesamorelin discount, they'll give it to you there too as well. All right. And Barter said, why do you have to not have carbohydrates before you're taking Tesamorelin? So, yeah, usually when you take any medication like this, GHRH, you usually don't want to eat between 30 and 45 minutes. And that's because, you're talking about sugar spikes and the whole nine with carbohydrates possibly. So the rule of thumb to get the best possible result with the best possible absorption is to take GHRHs on an empty stomach. Whether it's CJC 1295 with ipamorelin or Tesamorelin, at least 30 to 45 minutes. I feel like somebody, like an old parent saying, you can't go swimming after you eat for 30 to 45 minutes. That was a myth. It's going to definitely work better. So that's more of like a fact for you. All right. KR Holly, what's going on? Blackrock, what's going on? My man, Andreas. Sorry, Andreas, I had to come here and do a live, dude. I'll talk to you right afterwards. Edie Jimez, what's going on? Squints, how you doing? So that's the deal with Tesamorelin. Like I said, Tesamorelin is a game changer across the board. It's going to help in so many different ways, from anti-aging, sleep patterns, hair, skin, nails, energy, putting on lean mass, and helping target adipose belly tissue. Belly fat, right? Get rid of it. That's awesome. And who doesn't want to get rid of belly fat? I don't see anybody that would raise their hand for that. So, next one. What's going on, Daniel? How you doing? So, after that, let's talk about anything else. You guys got any questions for me? Please shoot them out for me. If not, I've got some good topics for you today. And the first topic that I'm going to talk about today would be, let me see my topics here quick. All right, I have one on psychedelics for you and one on blood proteins to look at for cancer. Let's talk about the psychedelics first off. That's more of the happy one, I would say. So psychedelics, they're looking at right now on treating chronic pain, right? Real pain that people have, and they have to go to pain management for. So with psychedelics, they've been pushed very hard the last couple of years. And psychedelics have came out, whether it's magic mushrooms or LSD. These have been a game changer for mental health patients. So people that have mental health, they were like, listen, let's try this psychedelics. They opened up the trials and have used psychedelics on patients that had depression, mental health issues, and have had great, significant results in turning these people around. So that's awesome because it's more of a natural thing. It's not an antidepressant that's messing with the chemistry of your brain, and at that point, turning you into a zombie. If we could have more natural ways, like magic mushrooms per se, which psilocybin is the main active psychoactive drug, or psychoactive chemical in the fungus. So at that point, like, you can utilize that and hopefully, one, depression, right? And that was the main thing they found it for. But when they were doing the trials, right, some of the patients were saying, I don't have my chronic pain anymore now taking this. And they're like, damn, really? Like, I'm breaking this down. But they're like, really? Like, oh, wow. Like we need to start studying this next. So at that point, they started studying it and they started seeing a lot more patients. I think it was out of 30,000 patients, it was 4,900 patients talked about not having the symptoms of chronic pain by using the psychedelics. Game changer. Because usually people that have chronic pain go to pain management. And usually when you go to pain management, you're getting painkillers, muscle relaxers, things of that sort. Things that are going to slow you down, could impair your judgment, can impair your driving, all these different things, right? That could be very addictive, okay? And then we're talking about psychedelics. So we're talking about magic mushrooms. Now, psychedelics, like LSD or magic mushrooms, psilocybin, are not legal in the United States by federal government law. There are some states that are opening up to this. And usually the states that always open up to new things right away, I hate to say it, is the West Coast. They're more liberal, they're more free, they're more open. So, just like medical marijuana, California was like, the birthplace of that for a long time. And now we have these new psychedelics that are taking place. So hopefully, these do help patients. And they were talking about, MDMA being approved by the end of this year for PTSD. So at that point, MDMA, I'm like, wow. I'm like, people are going to be taking like Molly, like ecstasy type stuff. I'm like, man, this is crazy. But if it does help, I'm like, I'm all for it, right? They're not getting high like that. They're treating a medical condition, and if that will treat it, that's awesome. Because there's so many people out there, especially our servicemen and women, that suffer from PTSD. And I have a ton of patients that are, veterans and active military that may have this PTSD, right? And it's not the active, it's usually the non-active. And some of these guys have seen a lot of crazy stuff. Some of them are special forces and all that, and they've done some crazy stuff. And they have PTSD from it, just from everything and all the action. So, at that point, I'm all for helping people. And if something is going to help people, has real medical necessity or use, then at that point, we got to be able to try it. I mean, think how long we've been steering away from marijuana for. And, I'm not a big marijuana advocate, right? But I think marijuana is okay if you're going to use it for a medical use. If you're using it for anti-anxiety, maybe at the end of the day before you're going to sleep. I'm not talking about driving around smoking it. I'm not talking about walking around the street smoking it. Nothing like that. I'm talking about using it for a medical condition or medical reason, something to help you. I think that, we should open ourselves up to being able to do this, and especially if it's a personal use scenario. If they're not selling this stuff, like you're not selling keys of cocaine or, you're talking about medical marijuana, and in most states, recreational marijuana. And when I visited New York 2 weeks ago, I might as well bring this up, walking down the street, you do smell marijuana everywhere because it's recreational and it's totally legal to walk down the street and smoke a joint or smoke a blunt or smoke a bowl or whatever the hell it is. So it was kind of crazy for me to see that, right? Because, here you have your medical card, you have to be in certain places. You can't be in certain places. It's not something you can do in public right in front of everybody. So it's definitely changed, my thought of things. And I don't see it being a bad thing. Obviously, I see kids like maybe trying to reflect it and stuff like that, but that's going to happen with anything. And that can happen with alcohol, cigarettes, chewing tobacco, vapes. Think about how much vapes have taken over, especially kids. A lot of kids are smoking vapes. And I'm not talking about marijuana vapes. I'm talking about nicotine vapes. So we traded off from cigarettes to something electronic that can give them a bigger puff, basically, right? And it's easier to hold and that you can do, and vaporizes away, so it's not clouding smoke. So they can do it very indiscreet and underneath everybody's, eyes, basically. So at that point, we really got to start looking at these things, and we need to help people that are in pain. We need to help people that need some of these open options to maybe help them with chronic pain instead of the painkillers, or depression with antidepressants, maybe utilizing some of these different treatments that are more holistic in my mind, and that can definitely help. And I've seen these things help a multitude of different people. So at that point, seeing is believing, right? you can hear about it all day. But if you see it, especially more than once, it's hard to like tell you that, no, that doesn't work. Like, yes, it does. So I'm all for that. We got any other questions? No, but we got somebody from, I believe that's Japan. Big shout out, Rue. I appreciate everybody joining us in. Thank you. All right, so let's talk about one more. And if you guys don't got no questions, I'm going to go. All right, so blood proteins could indicate cancer 7 years before diagnosis. Now, cancer, especially now, is taking more of a priority in my life. Studying cancers, especially different specific cancers like colorectal, prostate, and all these. I've really dove deep into this, looking for all kinds of holistic treatments out there, ways to cope with symptoms of chemotherapy and radiation. What's the best possible routes? What's the best possible nutrition? All these different things. Because my dad has colorectal cancer, stage 3, and I take him every week to his chemo, which was today. And some weeks he hasn't had chemo because, one, his white blood cell count was low one week because it takes all that. So they had to inject him what stimulates his bone marrow to create more white blood cell count. And then today we go, and they always do blood work before to check those different things. And at that point, they said his potassium's high. And they're like, oh, well, you might have to go to the hospital for this. And it's like, you need to go downstairs to get a drip to lower this potassium right away. And then we might transport you to Tampa General to be admitted for a couple of days. I'm like, oh my God. And I'm leaving tomorrow at 9 a.m. So luckily I have a good support group around me and have a lot of good people around me, which I'll be able to take care of them the right way. But it's just crazy how things work out. And you always got to be ready for the curveball. And especially, me, I've learned one thing. Nothing comes easy for me. I have to work for everything I got, which is okay, and I appreciate it more. But at that point, sometimes it gets a little frustrating. And something like this, with cancer, if we can look and find cancer in early detection in different ways like this, like proteins. And there's 40 different proteins that could lead or be red flags to serious cancers. So when we look at some of these different things, I think it's a game changer. There's 19 different cancers identified, and scientists identified 618 proteins linked to 19 different types of cancer, including 107 proteins in a group of people whose blood was collected at least 7 years before diagnosis. So at that point, they got to look at this blood and they got to see, hey, listen, this is what we need to look at to see if this person has cancer. And that's a game changer. I mean, I know even in colorectal, there's new ways to check instead of the old way, colonoscopies, and then, obviously for prostate cancer, the finger method and a blood test with a PSA. So, yes, and do I believe in those all the way yet? Jury's still out, right? I believe maybe, but I would probably still go get the colonoscopy. And that's something I'm going to be setting up for myself, very shortly. I'm 43 years old, and, now that my dad has colorectal cancer, it's put me at a higher risk for colorectal cancer. And I was just reading through this, with cancers and stuff like that, it really comes down to genetics. It does. It plays a major role in what cancers you get and how fast and what develop. So at that point, you're made from the fabric of where you come from. And if they have those in their genes, they probably are going to pass them down to you, most likely. So it's really another essential thing to know your family health history, if you can. There's some people that are adopted, parents die, they have no idea what their family history is, and that sucks. But at that point, if you do know your family, then you can know what the family history is and be more educated about what you may need to do to be more preventative, to save your life, help your health, optimize it. You don't know, right? So at that point, this is something you really need to pay attention to. And there's all types of genetic testing out there now that you can run to see these different things. So I would definitely recommend that. There's scans out there that can scan you head to toe for cancer now. I mean, really game-changing technology that I love to see. And it just rapidly keeps coming. So keep it coming, guys. I hope the geniuses out there and brainiacs and everybody working in these fields really are hyped up about helping people and getting more technology out here that can help them identify certain things like this. David Root, just want to give you all a shout out and thank you. 1 month on AOD, Titan Ultra, and tirzepatide, and I'm down 20 pounds. Dude, that is awesome. Now, David, I know we talked last time. How's the muscle? You're keeping on the muscle? How we looking there? I want to make sure you're on track, get the best possible results. I'm very, very happy that you've lost 20 pounds. Now, I'm telling you guys, Before the GLP-1s, we have great therapies like AOD, ECAs, and a couple other ones that will get you some good weight loss. But being able to add in semaglutide or tirzepatide on top of some of these different things that we have are game changers. And even alone, I mean, you're going to lose weight with these things alone, but adding on these different things, you get different results too, right? So it's so cool to see some of these different combinations and the result that patients are getting. So I love it. I love it. Just please keep coming at me. Let me know how things are going. I love to hear about the progress, and I love to see the result, man. So it's awesome. Jay Valito, what's going on? How you doing? Who is Brian Lavish Locks? What's going on, Jordan? I hope all is well. All for Jimenez, how you doing? And David said, all is good with the muscle. I think it was just my body trying to react to something new. Maybe so. Maybe so. You keep training, though. Keep lifting those weights and doing your thing and trying to get that protein in. And I promise you're gonna hold on to that muscle, and I guarantee you're gonna start leaning up like you already are, and you're just gonna keep going. And then when you hit your goal, listen, you can maintenance these things too as well. So a lot of patients don't realize that. And patients usually want to get on these things to lose weight, right? And at that point, they lose weight. And then they're like, all right, cool, I'm gonna get off. And then they don't change their lifestyle, and at that point, they rebound back. And then they have to go back on and start from all over again, right from the beginning. Instead of, there is a maintenance protocol that we do. So you're not taking it every week, maybe bi-weekly, and you're still maintaining that weight, but you're not losing anymore. Because, there's only so much weight people want to lose. And I totally understand that. You don't want to look anorexic, okay? That's not a good look. You want to look healthy. Lean, but healthy. So at that point, having the BMI there I think is good, maybe, depending on XStat. BMI, I wouldn't even go by. How your clothes fit, how you look in the mirror, right? How you're feeling. These should be the directives that you should be looking at and the things you should be judging the result on, right? Anthony, how you doing? Rox, how you doing? Elizabeth, how you doing? 352, what's up? So guys, anything you guys want to talk about? I talked about Tesamorelin earlier, which is a peptide therapy. It's a growth hormone releasing hormone peptide that targets visceral belly fat, right? So I hope you guys are grasping that concept, because there's no other drug out there like this that does that. So super cool, super, super cool. And, a lot of patients ask me like, why would, was this like made for weight loss, or was this made for like growth hormone or whatever? And you know what Tesamorelin was made for? Tesamorelin was actually made for HIV patients. And you're going to say, well, why? Because HIV, usually there's a couple of things that are happening. The one major thing that happens with HIV, that this is why they usually get growth hormone, is because they have muscle wasting. That means their muscle wastes down and it's gone, right? And you want to hold on to some muscle. So that's one. Now, you're asking, well, damn, it targets visceral belly fat too. Doesn't HIV patients, when they get real thin anyway? And, they do get thin, right? But the thing about it is they're usually on cocktails, these cocktail drugs. And at that point, that actually puts visceral fat on them. So this is actually fighting against those drugs. But for a normal, healthy person, you're not fighting against those drugs, and you're just targeting that belly fat. So it's really, really cool. And there's no negative side effects or anything else. It's a normal GHRH. Most people, this is going to be a good therapy for. There are some people this might not be a good therapy for. And I'm always going to be transparent with you guys and tell you guys the truth. But at that point, when you're taking Tesamorelin, if you have family history of cancer, or if you've had cancer before, this might not be the drug for you. Now, not to say, listen, somebody in my family had cancer. Somebody in my family has cancer too. That doesn't mean I'm going to stop my GHRH or my IGF-1. Not doing it, right? But I'm being more cautious and preventative, and maybe I need to look at some of these different things. Like, so my dad has colorectal cancer. Like, that's the only kind of cancer on both sides of my family that I know of. I don't know of anything else. So at that point, if I get checked up there, I'm preventative about that, then I'm maybe good. And, if they do find it, they'll find it in the early stages, and they can just get rid of it, and I don't have to go through chemo and all these things. That's the thing about being preventative. You're finding problems before something breaks down. Big. So, when you start doing blood tests, even through Titan, if you're a guy, there's a PSA on those tests, a prostate-specific antigen test. And what is that test? That tests your prostate, because prostate cancer is on the rise for males. And sorry, females, you guys get to sit this one out because you guys don't have prostates. So you're lucky on that end. But at that point, we do. So we have to look at this and make sure we're good there, because prostate can be a big, big thing. right? So want to make sure we are good there. Andre, what's going on? I hope all is well from Italy and Rome. Big shout out to my Italians out there. Everybody, I appreciate all you guys. I appreciate everybody around the world that tunes in. You know, it makes me happy. I love doing it, sharing the information. I want to make you guys more educated so you guys can make better decisions for your body, for your health, for your families, and for your life. I mean, that's really what it comes down to, man. You doing the right thing for your people and yourself. You know, and then after that, once you're doing good for you and your people, you can spread that knowledge and the happiness and the motivation and everything that comes along with it, and that passion, hopefully, to help other people. And I tell everybody every single day, you know, especially my patients, if you're a patient with Titan Medical Center and you get good results, you're probably sharing them on your social media pages, right? Even though let's say you don't tag us, whatever, that's cool. But you're sharing this information. Or you're going to the gym or you're going to your job and you've made tremendous results and people are noticing you. They're saying, man, what have you been doing? I want to do that. How have you lost so much weight? Why do you look so good? You look younger than last time I seen you. I get that one all the time. I'm like, man, stop pulling my chain. And I tell people most of the time, like, I better. I mean, I'm the owner of Titan. I better be the example. I better have the best of the best. So at that point, like, it's super cool, right? But the other thing about it that you don't even realize is that you're motivating other people that are seeing you. Whether they come up to you and tell you or not, they are motivated. And especially if they're overweight or obese and you've beaten that challenge of getting over that and slimming down and on your way, I'm not saying you're skinny as a twig, but you've made significant gains. Like David, 20 pounds. That's a lot of weight, guys. 20 pounds is a lot of weight. 1 pound is a lot of weight. 5 pounds is a lot of weight. 10 pounds. Think about 20 pounds, right? It's a lot. Go, if you don't believe me, girls, guys, whatever, just go to a gym, pick up a dumbbell. That's 20 pounds. That's a lot of weight, man, for sure. So at that point, I'm super happy and proud of all the patients out there. Chris Martin said, what's up, John? New patient here. What's up? How you doing? NYC. Your PT181 took me from 0 to 100. I love it, bro. I love it. So that's great, you know. And big shout out to NYC. I was just out there a couple weeks ago, man. You know, I took my son out there for the first time. Got to see a Yankees versus Mets game right behind the home plate. You know, we got to see Vanderbilt won. Went to both Nike places and in Soho and Times Square. Put a billboard up of our family on Times Square. Got pictures of that. Super cool times. Got to just check out, you know, and be tourists for a little bit and show him around town. Carriage rides. I mean, I did everything to give him the full New York experience. Pizza, multiple places in Brooklyn, Queens, Manhattan. So we got the full experience out there. It was really, really cool. But I'm glad you're liking the PT141. And if you guys don't know what PT141 is, this is the game changer libido enhancer. Way better, in my personal opinion, than Viagra or Cialis, Tadalafil or Sildenafil. The reason is because PT141 is FDA approved. It works on females, it works on males, and the best thing about it, it creates real sex drive, real libido enhancement. For you guys out there that have taken Viagra or Cialis, which is Sildenafil and Tadalafil as the active ingredients, you know that you're probably going to get a great erection, right? You're going to get an erection. That has nothing to do with stamina, endurance, or sex drive. And what I mean by sex drive is you wanting to do it. And if you've got that, cool. But usually what happens is that the guy goes one time, can't go again. Now you need an erection and you need the sex drive. Best thing about PT141, it works on the nervous system for true libido enhancement. Females can help orgasm that have never orgasmed before. They're going to be more into it. There's a lot of guys that come to me and tell me, hey, John, wife just, man, it's been a couple weeks, couple months, a year. I'm like, oh. A year, I'm like, oh. But a couple weeks, I'm like, months, I'm like, bro, you need to start laying it down. So at that point, like I tell them, and they're like, well, they're just not into it, whatever. I'm like, you need to get her hooked up then. Because when she starts taking this, it's going to be the opposite effect. She's going to be clawing at you. So that's the great thing about this. And for guys, same thing. You're going to have the true libido effect. You'll get the erections too as well. So you get best of both worlds. Smart said, correct. I would only get blood rushes with those pills, but not the feeling to perform. And that's the difference. That is the coolest thing, Chris. It really is. It really is because, vasodilators, right? Like even amino acids like arginine or L-citrulline or Hercules, you'll get an erection, right? And a good one. And if you take sildenafil or tadalafil, Viagra, Cialis, you're going to get an erection. Now, the bad thing about some of those drugs like sildenafil, Viagra, is that there's a small to medium percentage of people that get negative symptom side effects. What do I mean by that? They get real flushed. Chest looks bright red. Face looks bright red. That's a telltale now to the females or whoever you're doing with. Hey, listen, this guy's on something. So you cannot claim natural when you do it. The second thing is it makes people stuffy. They feel like they're congested. Congested and all this. Third thing, headaches. A lot of people get headaches. So, I understand. And some people take Advil or Tylenol to get rid of those headaches or along with the sildenafil so it doesn't happen. That is a good preventative. I would use that if you are using that. But otherwise, PT141 does a trick. And the best thing about it is maintenance dose. So once you start PT141, it's like 1 to 2 shots a week. Subcutaneous, little ones, right? Insulin needles. And then you're good to go. Whenever, wherever. I don't care where you're at. You're going to be ready to go. And you're going to be feeling like this whole time, which is confidence, right? You got the stud confidence going on. And females get the same thing. So, if you and your partner are utilizing this, watch out. You guys are going to be so pleasure, passion filled. It's going to be ridiculous. I'm really, really getting excited about this because, I believe, listen, we're here on this earth as human beings, for a couple different reasons, I believe. One is, procreation, right? That's a big one. But otherwise, what do we have to deal with as people, right? As human beings, we deal with emotional health, physical health, and sexual health, right? And a lot of relationships lack the sexual health that it needs. And people laugh at me when I say it, like, yeah, sexual health. Like, no, I'm being serious. Like, if you're not having sex, like, in good frequency, then at that point, you're unhealthy in that level. It'd just be like you're not eating good food. You're unhealthy in that level, right? You're having unhealthy thoughts. You're emotionally unhealthy, right? Like, these are things to look at. And at that point, we want to make sure that we're good in all these states. And sometimes you get busy, and sometimes you're concentrated, or sometimes you have so much stress on different things and different levels. You're tired. You've worked all day. You've had kids all day. You don't care. Like, sex is the last thing that's on your mind. That's okay. I understand that. But you need to realize I need to start setting time aside with my partner, or I need to find a partner or somebody that I can de-stress with and have a good time and release some of these frustrations that might be building up to as well. That's another thing. And it helps with mental health, right? I'm not saying to go watch porn all day and to masturbate all day because that's not going to make you any healthier mentally. But, a good sexual healthy relationship will help you. I guarantee it. All right. Anything else on here? Do you guys got any more comments, questions, anything for me? All right, then. So at that point, I'm going to leave it from there. I'm heading out tomorrow. I'll probably go live from out of the country where I'm at. And at that point, I'll probably be giving you guys some talks or maybe some Q&As. So if there's anything you guys want to hear about, if there's anything you guys want answers on, anything you want me to talk about, DM the Instagram page, and I will go live this week sometime and go over things and talk about things and showing you guys what's going on where I'm at. I always like letting you guys in on that. All right. So that's it, guys. I appreciate it. I'll be back next Tuesday for Titan Talk Tuesday with me, John, CEO of Titan Medical Center. And I'll lock down a certain time for you guys. I've been going on from 4:30 to 5:30. I've been kind of switching it up. I was at 6 normal for years. So I'm just trying to find a better time, maybe a little bit earlier to catch you guys. So if you guys have any ideas of what would be a better time too, hit me up on the DM. I appreciate it. Thank you guys so much. Big shout out to all the patients out there. Chris, Dave, thank you for sharing your stories. I appreciate all you guys. And I'll see you guys next Tuesday for Titan Talk Tuesday with me, John, CEO and founder of Titan Medical Center. And if you guys are looking for ad agencies, I'm starting my own with a couple of really, really good people. And we're going to be helping people out nationwide. So if you guys think that Titan does a good job at marketing, I got some great things for you guys. So I'll see you guys next Tuesday at Titan Talk Tuesday. Me, John, CEO. Love you guys.